Hello everyone, welcome to Pediatrics by Dr. Anand. Let's start with the clinical question discussion. Beautiful topics, beautiful questions, kind of a rapid revision. Before starting any segment, we always have a quote. And what is the quote for today? The quote for today is medicine cures the body. Medicine cures the body, but teaching saves the soul. Teaching saves the soul. So basically, basics plays a very important role. Like we all know how to cure the body, but if you know the inside of rationally of how you are doing things, then you are indirectly reaching the soul, saving the soul. So medicine cures the body, but teaching saves the soul. The growth chart of a child depicting changes in head circumference is shown below. Which of the following conditions is he most likely suffering from? So growth chart is shown. Number one, growth chart. Like we have the birth, 1 year, 2 year, and this side, if you see, this is the head circumference of the baby, and this black dot is above the all percentiles. Like the 97th percentile is the biggest percentile, and the patient head circumference is much more than that. So it means we are talking about macrocephaly. So we are indirectly asking you which of the following conditions causing macrocephaly. Remember all the syndromic babies, like all the babies who are suffering from like fetal alcohol syndrome, where the patient has a smooth philtrum and thin upper lip, even the hypoxic ischemic encephalopathy or syndromic baby, later their brain shrinks and they land up into microcephaly, and phenylketonuria also the baby land up into microcephaly. So the macrocephaly, the question answer is nothing but achondroplasia that causes macrocephaly. The head circumference is more. And what is macrocephaly? Head circumference more than 2 standard deviation. A 4-year-old patient is brought to the emergency department after accidentally ingesting an unknown quantity of iron tablets. Iron is a case of iron poisoning. Which of the following is the most appropriate initial management? Induce vomiting with syrup of ipecac, administer activated charcoal, perform gastric lavage, and administer intravenous deferoxime. So we have two options, that is defiracirox and deferoxime. So in the iron poisoning, I should give chelators. We should take the iron from my body and excrete it, and that's why deferoxamine is a very good answer over here. Even in the case of thalassemia also, alpha thalassemia, beta thalassemia, there also multiple blood transfusions is there, and they also be these people land up into thalassemia patient land up into iron overload. So those babies also we give deferoxime. So please remember that. Okay, in a pediatric patient, which anthropometric measurement is used as a measure of emaciation of wasting? Very important. So we all know World Health Organization, W for weight, H for height, and A for age. So if there is decreased weight for height, that is known as wasting. So decreased weight for height, that is known as wasting. If this was height for age, decreased height for age, that is known as stunting. So whenever the height is coming first, that will be stunting, and when the weight will be coming first, that will be wasting. Wasting is known as acute malnutrition, and stunting is known as chronic malnutrition. Nisha presents to the clinic with clinical features suggestive of Kawasaki disease. She was admitted to the ward for treatment. Which of the following is the treatment of choice for Kawasaki? So treatment of choice for Kawasaki, remember very importantly, IVIG and high dose aspirin. IVIG and high dose aspirin is something we give in a case of Kawasaki disease. And if this is like she's admitted right now. If the question was she's admitted and treatment was given, she's discharged, now coming to follow up with you, then what is the management? Then if she's coming for follow up, remember IVIG has no role, and you will give low dose aspirin. So these are the important points must appreciate for the exam purpose, you should know. Okay, a child has come to you for the administration of IPV vaccine as a part of his routine schedule. Which of the following antibiotic may be found in this vaccine? Yeah, but I read it also recently, this IPV. What is IPV? Inactivated polio vaccine. What is OPV? Oral polio vaccine. IPV is inactivated polio vaccine. This is live, and inactivated and means that is killed, and IPV is given injectable, but we don't say injectable polio vaccine, we say inactivated polio vaccine. Okay, and remember, the book says very importantly, this IPV vaccine, they may contain small amount of antibiotics to prevent the bacterial contamination. To prevent the bacterial contamination, these vaccine contain small of antibiotic, and we use neomycin, streptomycin, polymyxin B. So neomycin can be used, streptomycin can be used, and polymyxin B can be used. That's why automatically streptomycin becomes the best answer. They are used in these vaccines. Okay. At what age would a term newborn with normal growth and development and a birth weight of 3 kg is expected to reach around 15 kg? Okay, 15 kg. He's 5 times from the birth weight. So birth weight is 3 kg and he's reaching 5 times of the birth weight. 3 into 5 is 15. So we all know that weight doubles by 5 months, triples by 1 year, 4 times by 2 years, and 5 times by 3 years. 5 times by 3 years. So weight doubles by 5 months, triples by 1 year, 4 times by 2 years, and 5 times from the birth weight by 3 years. So 3 becomes the best answer. Okay. While assessing an 8-hour-old newborn, a nurse notes at an auxiliary temperature of 36.1 degree Celsius. Nice question. 8 hours old newborn, the temperature is 36.1 degree Celsius. What should be the nurse first intervention? First of all, is it normal or not normal? The normal temperature of a newborn is 36.5 to 37.5 degrees Celsius. The normal temperature of a newborn is 36.5 to 37.5 degrees Celsius. So any baby between 36 to 36.5 degrees Celsius is nothing but mild hypothermia. The child right now is into mild hypothermia. 32 to 36 degrees Celsius is moderate hypothermia, and less than 32 degrees Celsius is severe hypothermia. So in this question, document the findings, place the infant in the warmer, feed the infant with warm formula. Warm formula, we don't feed like that. Call the healthcare provider to report the finding. Like before even calling the healthcare provider to record the finding, I would rather, it's better for a nurse that she should keep the baby in the warmer and then inform the consultant. So place the infant under the radiant warmer is a better answer. Document the finding. Again, obviously she should document the finding, but I think she should keep the baby in the warmer and then document the findings and then inform to the healthcare provider. During the assessment of a 40-hour-old term baby, how should the nurse evaluate the infant for jaundice? In a 40-hour-old baby, how do you look for jaundice? Remove the diaper and assess the color of the genitalia. No, we don't assess like that. Color of genitalia, we don't do that. Applying the pressure on the forehead for a few seconds and evaluating the skin color after releasing the pressure. Yes, that's what we do. After applying the pressure on the forehead, on the trunk, on the chest, on the abdomen, on the legs, and then we remove my finger and see whether the yellowishness is there, yellowishness blanching is there or not. So basically we evaluate the skin color after releasing the pressure. Okay, assess the color of the palms of the hands and compare to the color of the soles and feet. No. Assess the color of infant's tongue and palate. Infant's tongue we see for cyanosis, but not for jaundice. 20-month-old child is noted to have a weight for height less than -3 standard deviation. So weight for height less than -3 standard deviation is known as severe acute malnutrition. That's a dedicated MCQ. MUSC 11.5 in pedal edema. This is a proper definition of severe acute malnutrition. In the management of this child, which of the following is not supplemented in the stabilization phase? Whenever a baby is admitted to us, the first week, the first 7 days, we stabilize the child, and that is known as stabilization phase. And then we have something known as rehabilitation phase. So we have stabilization phase where we give all the micronutrients, folic acid, vitamin A, vitamin K, iron, not iron, everything we give, but only thing is we don't give iron because iron is given in the rehabilitation phase. Iron is given in the second week of the illness, known in the rehabilitation phase. Okay. Which screening test is neonatal is a neonatal nurse most likely to use to detect the developmental dysplasia of the hip? For developmental dysplasia of the hip, we have two tests. One is Barlow test and one is Ortolani test. One is Barlow test and what is Ortolani test? In the Barlow, B for Barlow is a bad test. Why? Because in this test, first you will dislocate the baby's hip joint, and in Ortolani, you will relocate the baby's hip joint. The goal is not to be perfect by the end. The goal is not to be perfect by end. The goal is to be better tomorrow. Beautiful quote. The goal is not to be perfect by end. No one is perfect. If you think you are perfect, then you will not grow. The goal is to be better tomorrow. The goal is to shine tomorrow. The goal is to be beautifully positive tomorrow. The goal is to enrich yourself, fuel yourself with positive vibrations tomorrow. So that's very important. Okay, again, the next question, a quick 1 minute break. Like, just please read the question and we'll start again. When is the optimal time for a nurse to schedule chest percussion and postural drainage for a toddler diagnosed with cystic fibrosis to ensure the maximum effectiveness and safety? In a case of cystic fibrosis, a mother, while kissing her child, she found her child's skin salty tasting, and all the secretion gets stuck. All the secretion in the body gets stuck. That's why in the respiratory we get this cough, cold, upper respiratory, lower respiratory tract infection. That's why in the genitourinary we get azoospermia, because everything slows down and gets stuck. That's why this nurse, basically, we are doing this chest percussion and postural drainage to clear out the secretions from the lungs, basically. When should I do that? Number one, immediately after suctioning. Immediately after suctioning is not effective doing again because already in suctioning you have taken out all the secretions, right? That's why just after suctioning you are doing this chest percussion and postural drainage. No, it won't be of good use. Prior to nebulization, so that's incorrect, because aerosol therapy like bronchodilator, mucolytic, or nebulization should be given before the CPT to open the airways. Basically, before the chest physiotherapy, we nebs the patient, and then what you called so we do that. So if prior to aerosol therapy, that is a wrong answer. 15 minutes after meal. No, after a meal, if you do a postural drainage to someone or physiotherapy, then definitely he can have a vomiting. So chest percussion and postural drainage, when it is done, the best one is 1 hour before meal. 1 hour before meal, because then there is no vomiting or regurgitation sensation, and this is the best time. It maximizes clearance and avoid vomiting or aspiration. A 7-year-old child of migrant laborers present in the pediatric OPD with loss of appetite, fever, and persistent vomiting. RBS was done, it was 40. RBS is bad, it's 40. On charting, his weight for height comes out to be less than -3 standard deviation. So weight for height less than -3 standard deviation is known as severe acute malnutrition. But remember, severe acute malnutrition is common in 6 months to 5 years. 6 months to 5 years. This baby is 7-year-old. So severe acute malnutrition is not expected. You don't say SAM. You can say the child is having failure to thrive. He's not gaining weight and height. The child is having failure to thrive. That word can be used, but SAM is not used here because SAM is still 5 years. The question is the doctor decided to put the child in the NRC, that is Nutritional Rehabilitation Center. Which of the following is not an indication of eligibility of child's admission to NRC? So Nutritional Rehabilitation Center. Which of the following is not an indication for admitting the child? Edema, anemia, hypothermia, and tachycardia. So please remember, very importantly, as a SAM is important, like weight for height, MUAC, and edema. So if the edema is there, definitely I have to admit the child. The question is which is not an indicator for child admission. So anemia, naturally someone is having anemia for blood transfusion, I have to admit the child. Hypothermia can land up into shock. Hypothermia, again, that's a bad thing, that's not a good thing. So in these three conditions, basically you will admit the patient. Just tachycardia, you will not admit the patient. Just isolated tachycardia is not like, oh my god, I have to admit the patient. But edema, anemia, hypothermia are the indications for admission. 11-year-old child came with history of fever for last 4 days with headache, backache, with rash in the back and the forearm. Okay, and platelet count also decrease. Okay, fever for 4 days with rashes over the body and platelet count has decreased. So platelet counts obviously has, okay, question is which of the following tests help to diagnose dengue virus at this stage? Even though the examiner would not have told me dengue virus, I was going to say dengue only, because fever with rash with thrombocytopenia, dengue is something which is the first thing you should do. And most importantly, if the fever is just like less than 5 days, so dengue NS1 is a very good answer. Dengue NS1 antigen is very good answer till 5 days of fever. If the fever is like more than like 7 days, 10 days, 14 days, then dengue serology. Dengue serology, that is IgM and IgG, ELISA, dengue serology would be a better answer. Okay, and yeah, that's it. What are the cardinal determinants of undernutrition? Cardinal determinants of undernutrition. The child is undernourished. What are the cardinal things? So basically, if the child is not eating, having food, that also is a determinant that will cause undernutrition. Infections also, repeated infection can cause not gaining weight and height, and low birth weight also is an indirect marker of undernutrition. So all of the following are the cardinal determinants of undernutrition. Which is correct statement for the image shown below? Now this image, if you don't know, it's a buttocks, and this is bluish patch known as Mongolian spot. It is a case of Mongolian spot. Yes, that's the right answer. Regression is spontaneous by 10 years of age. No, not 10 years. By 1 year of age, it regresses. Complete migration of the melanocytes from the neural crest. No, there is no complete migration of the melanocytes from the neural crest. The color is because of the melanocytes are located superficial in the epidermis. No, the melanocytes are located actually deep in the epidermis, not superficial. So simple. The best answer is Mongolian spot. Which is the most common location for Mongolian spot? The answer is lumbosacral region. A student who is taught only facts will remember little, but a student who is taught to think will remember forever. Very beautiful point. A student who is taught only facts will remember little, but the one who is taught to think, that's very important. You are the healthcare professional on duty. What will you do? So always we ask a question like this. Now, don't cram. That's why they say if you have time, watch the main videos also, and then for rapid revision, watch these videos. Or even if you're watching these videos directly, just always have a thoughtfulness that why this is happening. Think logical to the question. That why, and why. If once you know the why, you'll automatically get it. An infant is born with a cleft palate. Which actions will promote oral intake until the defect can be repaired? First of all, for the cleft palate patient, we have a specific bottle. This is a bottle, like a pigeon bottle. We call this like a pigeon bottle. Okay, so this basically, this nozzle is very big in the case of this, because I have a cleft palate now. So directly the milk I want directly should go to the to the pharynx, okay, to the food pipe, not touching the any part of the palate. So that's why it's a pigeon bottle, where directly it will go to the baby's mouth. So this nipple is very big. Normal nipple is like this. This is the normal nipple, but this one is a pigeon shaped nipple used in the cleft lip and cleft palate. So angle bottle up and down and toward the cleft. Okay, which action will promote the oral intake? Angle bottle up and toward the cleft. No, toward the cleft you will not do that. So the milk will go from the cleft and it will come out of the nose. Burping the infant often, that's nice. You should burp often. Feed in the upright position is very important. That's what to prevent the aspirations basically. बच्चे को थोड़ा सा उठा के दूध पिलाएं. Little upright position is good. Feeding slowly over 45 minutes. No. Feeding 45 minutes, feeding it will be too much. Okay. Use a specially bottle or special nipple. Yeah, that's very true. Just now I showed you the photo now with special nipple. That pigeon nipple is there. So that's why the best answer for this question is C, 3, that only B, C and E are correct. Okay. This is very nice picture. Could be an image based picture also. Okay. And burp often, feed in the upright position, speciality bottle, these 3 highlighters. What is the diagnosis of the child shown in the image whose mother is having bronchial asthma? Now if examiner is telling you the mother is having bronchial asthma, so basically this baby is having rashes in the body. So this is kind of a atopy. This is the atopy. Atopy means away from the normal place. Like as in if I'm having bronchial asthma in families, I'm gonna have some allergic reactions of the body or some rashes on the body, some repeated cough and cold. So it's like a atopy. So atopic dermatitis is a very good answer over here, because the mother is having bronchial asthma and he is having atopy, like rashes somewhere in the body. Okay, dermatitis means a rash and atopic is a site away from the normal site. Okay, why it is not seborrheic dermatitis? Seborrheic dermatitis dermatitis look like this, like a cradle cap. Beautiful picture, classical image based question. Fungal infection, newborn baby, sometimes it is self-resolving also. So atopic dermatitis. Okay, so I'll repeat again why it is not seborrheic dermatitis. That those are the yellowish grayish scales which favor the scalp, which photo I showed you. This one, this is seborrheic dermatitis, and yeah, that's what. And they are usually over the scalp. Contact dermatitis usually localized to the site of the contact. Okay, less likely symmetrical cheek involvement in the infant. Over here, if you see, he is having a symmetrical cheek involvement, which is less commonly seen in contact dermatitis, more commonly seen in atopic dermatitis. And why it is not irritant dermatitis? It is seen in the diaper area. Again, it is not symmetrical. So nice question. A neonate requires respiratory resuscitation, which is the proper head position of the neonate for rescue breathing. Always have the shoulder back. Always have the shoulder back, and the baby should be little in the sniffing position. Sniffing position. So little sniff. How do you sniff a rose? Like this. Normal. So neck, slightly extended neck with the shoulder back inside. A becomes the best answer. There is no shoulder back over here. The shoulder back is on the head. I want it on the neck. Okay, again, the neck is too hyperextended. The nurse is performing an assessment of the neonate 1 hour after spontaneous vaginal delivery. Which of the following are expected normal findings in the client? Expected normal findings in a neonate. Beautiful question. Capillary glucose of 60. Then so less than 45 is hypoglycemia. 60 sugar is cool. It's fine. Pansystolic murmur auscultated in the fourth intercostal space. So pansystolic murmur is expected in the fourth intercostal space. Very importantly. So pansystolic murmur, where do you see pansystolic murmur? So pansystolic murmur, I'll repeat again, it is seen in a case of ventricular septal defect. So this is not expected in a newborn. Like pansystolic murmur is seen in a case of ventricular septal defect, but which of the following are expected normal finding? This is not a normal finding. Capillary glucose is definitely a normal finding. Respiratory breaths 56 per minute. The normal RR of a newborn is 40 to 60. Yeah, this is expected in a newborn. Single transverse crease across the palm of the hand, that is seen in a case of Down syndrome, not expected in every newborn baby. White papules on the bridge of the nose. On the bridge of the nose, white papules. So macule is change in the color and papule is little elevation also. So that is like a milia, this one. So this is milia. So milia is something, yeah, this is normally seen. Sometimes keratin deposition on the skin can be seen. So this can be seen. So I'll repeat again very importantly, all are correct. So what do you think? One second. Exactly. So the answer for this question is which of the following are expected normal finding? So A, C and E. I'll repeat again. A is expected, C is expected and E is expected. A, C and E are expected in a newborn. This is a normal finding. Okay. So A, C and E. So I would rather, I'll make one option number 4 which says A, C and E are correct. So now option number 4 becomes best because here it is ACD, ADE and ACD. So yeah, ACE are correct. That becomes automatically the option number 4 I'm making right now over here, and that becomes correct. That is A, C and E are correct. Okay, simple. A diabetic woman has a precipitous delivery. Precipitous means sudden she got delivery in the emergency department, which initial neonatal assessment finding is not as expected and is a priority for nursing response. What is not expected? Apgar score of more than 7, expected or not expected? This is expected. Every baby should cry happily, no? It's not like a diabetic woman's baby will not cry. He would cry. It's expected. A heart rate of 160. So the normal RR of a newborn is 120 to 160. Fine. Little till 160 I can expect. Circumoral duskiness. Little circumoral around the oral. Little cyanosis or duskiness. Yeah, some babies have acrocyanosis and all that, kind of expected sometimes. And jitteriness like this, no, that is not expected. Remember, jitteriness is abnormal. It is a sign of hypoglycemia. Jitteriness can be like hypoglycemia, hypocalcemia. So jitteriness is not expected. Circumoral duskiness can be transient. It may be seen after birth. You just monitor the child. Heart rate 160 normal. Apgar more than 7 normal. Okay. I like this ending the option breakdown which we do. Now, this is a very solid thing that actually rules out all the other options and you come back to one option. The nurse performs the first Apgar assessment of a newborn at 1 minute of life. The baby is completely blue with a heart rate of 110 per minute and is emitting a weak cry. The baby is actively moving and grimace when the nares are suctioned. What is the baby's Apgar score? Easy question. Apgar score. At first minute, okay, baby is completely blue. Completely blue is 2 number. Okay, let's do again. Completely blue. Completely blue. How much number? 0 number. If peripheries are blue 1 number. Totally pink baby 2 number. So baby is 0. Okay. Heart rate of 110 beats per minute. No heart rate, less than 100, more than 100. So more than 100, I would like to say over here I'll give 2 number. Here it is 0. Here it is 2. Is emitting a weak cry. Weak cry, I will have 1 number. No cry 0, weak cry 1, good cry 2. The baby is actively moving and grimace when nares are suction. Actively moving when the nares have very importantly, okay, are suction. So 1 second. So completely blue 0, heart rate 2, and is emitting a weak cry, and actively moving fine, actively moving I would give 2 number, and grimace when the nares are suction. Grimace itself is given 1 number. Okay, grimace itself is given 1 number. That's it. So 2 plus 2, 4, 5 and 6. The best answer for this question is nothing but 6. Okay, that's it. Next question. In every lesson you teach, there is a life you touch. There is a life you touch, and in every life you touch, there is a word you change. Very nice. Positivity plays a very important role. Motivation plays a very important role. Being happy plays a very important role. Being answerable to yourself, self-talking plays a very important role. Because in every lesson you teach, there is a life you touch, and in every life you touch, there is a word you change. So that's beautiful. Okay, next question. Again, a quick 10 seconds break. What do you think, guys? Very simple question. What is the answer? A nurse is teaching a client about breastfeeding. Which statement by the client indicates correct understanding of the teaching? If I need to reposition the baby's latch, I will use my finger to break the suction first. That's true. The mother is feeding the baby's nipple is attached. If she wants to change the breast or reposition the baby's latch, so she will first break the latch, break the suction first, and then by the finger, and then the baby will be out, and then she will let the baby suck the other breast. That is true. I will feed the baby for 5 to 10 minutes on each breast. No. You feed the baby from 20 minutes from one breast, 20 minutes from another breast. I will hold the baby on the back with the head turned towards my breast. Not specifically head turned. So head turned towards my breast is no. Baby's head, neck and body should be in a straight line. Not just one khali, only head turned. Head, neck, body should be in a straight line facing the breast. And baby should grasp only the nipple without the areola? No. The at least upper areola is exposed out of a mother, but lower areola, it is there in the baby's mouth. So the best answer for this question was option number A. When assessing neonates, the nursery nurse should report which finding to the healthcare provider. Means what is abnormal over here? What is abnormal? Chest wall retraction. Chest wall retraction definitely are always abnormal. It is never normal. Desquamation of the feet. Desquamation of the feet, kind of a peeling of the feet, kind of a normal skin change. Mild peeling definitely is okay. Remember that. Head circumference 30 centimeter. So head circumference 30. The normal head circumference of a newborn is 35 centimeter. Definitely this I should report that it is a case of microcephaly. And last but not the least, jaundice also. Of course, jaundice is something you should always inform. We need to check the serum bilirubin levels and all that, and that is one thing. Okay, and not voiding in 48 hours, that also I need to inform the healthcare professional, because baby should pass urine within 24 to 48 hours and stool within 24 to 30 hours. So till 48 hours is the end time, and I think I should inform. So that's why what I should inform: A, C, D, E. Retraction I'll inform, microcephaly I'll inform, jaundice I should inform, and not voiding in 48 hours, because the last time, because 48 is a cutoff, that time I must inform there. If it was there not voiding in 20 hours, not voiding in 24 hours, then I wouldn't have informed. That is okay, I would have thought like that. Okay. A nurse is completing a 1 minute Apgar assessment on a full-term newborn. The heart rate is 80 heart rate is 80. In response to this, the nurse should what? Simple, very simple question. When the heart rate of a baby is less than 100, what do you do? Simple, that when the heart rate of baby is less than 100, you start bag and mask ventilation, immediate positive pressure ventilation when the heart rate is less than 100. If the heart rate was less than 60, then what would you have done? We would have done the chest compressions and bag and mask ventilation in the ratio of 3:1. We would have done. Document a 2 for the heart rate parameter for Apgar. No, and first of all, this is not a 2 parameter. More than 100 is 2 parameter. Document 0 for the heart rate parameter in the Apgar. No heart rate, that's why we give 0. But this is 1 Apgar score. So these two are wrong options. Continue to evaluate the rest of the Apgar score. No. Baby is very sick. You have to do bag and mask. Okay, that's more important. A child came with the redness of eyes, fever, backache, and rash. So basically redness of eyes, conjunctivitis. Okay, fever, backache, and rash. So this is a typical centripetal rash. Centripetal. It's more over here. So this looks like a case of measles to me. This looks like a case of measles with a rash behind the ear, then the face, and then the body, and basically it get concentrated over here. What are the 3 C's of measles? The patient will have cough, the patient will have coryza, and the patient will have conjunctivitis. Cough, coryza, and conjunctivitis are the 3 C's of measles. Which is the most common complication of measles? The most common complication of measles is otitis media, and most common cause of death in measles is pneumonia. The most common cause of death in measles is pneumonia, and one of the late complication of measles is SSPE, that is subacute sclerosing panencephalitis. अच्छा, why it is not chicken pox क्यों नहीं है? Chicken pox patient will have a rash. He will have a vesicular, पानी वाले दाने, vesicular rash. The patient will have vesicular rash. Okay, fluid filled. Why it is not dengue? Dengue should have thrombocytopenia in the MCQ. That's why. So why it is not dengue? Rash may appear, but not with cough and conjunctivitis. Very true. Conjunctivitis, cough is all measles, not dengue. Why it's not chickenpox? Rash is vesicular, means fluid in chickenpox. Why it is not herpes? They are localized vesicles, often grouped, not like this maculopapular like measles. So that's why it's not herpetic rash. Nice. What is the organism responsible for this rash seen in an otherwise well child who has had oral ulcers? Whenever you have a photo of the hand, of the foot, and of the mouth together in a school going baby, otherwise well baby, it's a viral infection known as HFMD, hand, foot, and mouth disease, and the most commonest cause is Coxsackie A16 and enterovirus. That's why this is the beautiful answer. Slapped cheek appearance. Slapped cheek appearance, it is seen in fifth disease. Fifth disease is also known as erythema infectiosum, which is caused by parvovirus B19. And there is something known as sixth disease. Which is known as roseola infantum, and basically it is caused by human herpes virus, 6th strain more than 7, and which dermatological manifestation you will see? Nagayama spot. Nagayama spot you see in 6th disease, and slapped cheek appearance you will see in 5th disease. Why it is not measles? Measles will have a cough, coryza, conjunctivitis, and behind the ear rash. Why it is not chickenpox? Chickenpox will have a full body centripetal maculopapular vesicular rash, not like this slapped cheek appearance, you should know. Okay, the nurse caring for a child diagnosed with rubiola. Now please remember, the other name of measles is rubiola. One is rubella, where the patient has fever with rash with all lymph nodes activation, lymphadenopathies, but rubiola is the measles. She notes that the healthcare provider has a documented Koplik spot. So that's what Koplik spot basically on this whitish dot on the buccal mucosa is Koplik spots. The question is, on the basis of this documentation, which observation is expected? So basically, what are you expecting? What is Koplik spots? Are they pinpoint petechiae noted on both the legs? No. Pinpoint petechiae noted on both the legs, it could be idiopathic thrombocytopenic purpura, ITP, which could be there, but not Koplik spots. Whitish vesicles located over the chest? No. Vesicles would be chickenpox, but this is not this. Petechiae spots that are reddish and pinpoint on this soft palate. So soft palate, this petechiae points, these are known as Nagayama spots. So Nagayama spots are the spots or are the petechiae. rather basically on the hard palate, not the soft palate. Last but not the least, small blue white spots with a red base found on the buccal mucosa. Yes, they are the small blue white spots with a red base found on the buccal mucosa. So pinpoint petechiae on the legs seen in dengue or other platelet disorders, but not in measles. Vesicles are seen in chickenpox, not over here. And petechiae on the soft palate is seen in other infections like rubella, other infections like Sixth disease, Nagayama spot, multiple conditions. Even in rubella also you have something known as Forsheimer spots. So that you see there in soft palate. A nurse is caring for a 4-year-old child with celiac disease. Celiac. Whatever he eat, he go to washroom. Whatever he eat, he go to washroom. The nurse expects to find which of the following manifestations of the disease while assessing the child, obtaining the health history from the patient mother. Doctor, whatever he eat, he go to washroom. So whatever he eat, he go to washroom. Number one, definitely he will have malnutrition. And of course he will not gain weight and height because the patient usually land up into iron deficiency, anemia also in this patient. Whatever he eat, he goes to washroom. All the vitamins, fat soluble vitamin A, D, E, K, the fat soluble vitamins are not getting absorbed in the body. So all the fatty globules, steatorrhea and foul smelling stool, because my pancreas is not working properly. In these conditions my pancreas also is not working properly, so all the pancreatic enzymes are coming out of my body, and that only causes foul smelling stool. So that is why the best answer for this question is this only: malnutrition, iron deficiency, anemia, muscle wasting and foul smelling stool. Okay, so that's what. So again I'll say celiac disease, whatever he eat, he go to washroom. So malnutrition is because of chronic diarrhea, it's as expected. And muscle wasting also the patient will have. Systemic signs: malnutrition, muscle wasting, irritability, not gaining weight and height. GIT symptoms: diarrhea he will have, bulky stools, steatorrhea because fat soluble vitamins are not getting absorbed, and he's gonna have pain, vomiting. Lot of diarrhea will cause lot of constipation also, and pain also, and vomiting also. Okay, why it is not okay? Oh, this one, jaundice. Someone said jaundice over here. So jaundice is not typical of celiac disease. Even constipation is not typical, a classical feature. Diarrhea is more classical feature, you should know. And yeah, that's it. Last question. The nurse is examining a 11-month-old baby who has bought the clinic for persistent diaper rash. Okay, this is a diaper area and there is a rash. There is a perianal inflammation with satellite lesion that crosses the inguinal fold. The satellite lesion is classical for candida infection. Satellite lesion is classical for candida infection. Why it is not impetigo? Impetigo क्यों नहीं है? Impetigo is not on the, first of all, it's not in the diaper area. This is impetigo. This is like a honey crust appearance, impetigo. There will be vesicles will slowly get crusted and become like these honey crust appearance, madhumaki ke chhatte ki tarah, honey crust appearance on the clinical diagnosis. That's impetigo. So this is not candida, this is impetigo. Number one. Number two, why it is not urine and so see this one, this is a candida albicans, this picture is candida albicans, and this also classical candida albicans, where basically all these rashes are there in the genital areas, and that crosses the inguinal folds. It is crossing the inguinal folds. Remember that. So this is the beautiful point. And impetigo is honey crust appearance. It is not urine and feces. Its feces is candida, because satellite lesions basically are seen in candida infection. That's it. That finishes the whole class. Has everyone understood? Yes or yes? Please let me know in the comment section. Life is beautiful. Life is amazing. Thank you so much for the participation. You guys have been so amazing. If you have any doubt, still, you can ask me anytime. My mobile number, you can save it. My mobile number is 93544076777. Any doubt you have in any question, you can just put a screenshot to me on this number. That, sir, I'm not able to understand this question. Could you please tell me? If I don't reply you, you can message again. If I don't still reply you, if I by mistake don't see the message, you reply again till the time I permanently block you from my WhatsApp. You can message me and reply. It is 93544076777. Before leaving, we always have a quote. And what is the quote for today? The quote for today is: you don't just teach medicine. You teach medicine. You teach how to be calm in chaos, strong in sorrow, and kind in crisis. That makes you a beautiful, amazing person. You don't just teach medicine. See, we all are working so hard on the educational pillar, financial pillar, money chahiye, and education so important. Educational and financial pillar, yes, undoubtedly are very important. But what about the emotional pillar? What about the mental pillar? That plays a very important role, because little bit of mental pillar goes now, then everything goes. Okay, so that's very important. So you don't just teach medicine, you teach how to be calm in chaos, strong in sorrow, and kind in crisis. So thank you so much everyone, and before leaving, a very quick song for everyone. मैं चाहता हूँ सारे के सारे हम सब इकट्ठे गाएं, और जो गाना गाएगा उसी का ही क्लियर होगा. सो गाना कौन सा है? ओके, दैट वन, वो वाला गाते हैं. हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन, हो मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन. सो बस, अब होंगे कामयाब. वी आर born to rock, born to be amazing, born like a fire, like a rocking fire which will fire everything. That's it. So that's it. We thank you so much, and remember, आओगे तो वेलकम, आओगे तो वेलकम, जाओगे तो भीड़ कम. बस दुनिया में यही करना है. और वो कहते हैं कि दुनिया का बस एक अंदाज़ रखें, ज़िंदगी का बस एक अंदाज़ रखें, जो तुम्हें ना समझे उसे नज़रअंदाज रखें. ज़िंदगी का बस एक अंदाज़ रखें, जो तुम्हें ना समझे उसे नज़रअंदाज रखें. सो प्लीज़ टेक केयर. थैंक यू सो मच एवरीवन, एंड बाय बाय.